Board of Supervisors on that.
All right. Okay, so I'm going to call this meeting of the our special committee for the Board of Health concerning the opioid settlement funds. And I'll call this to order. It is now 2:02. And we'll take roll call from the Board of Health. Amy Crow-Sunley here. Sandra Larson here. Mike Fidgen.
Here.
I don't see anyone else. No. So we have 3 members from the Board of Health here. And would the guests also like to introduce themselves?
Brian again.
Captain Ricardo, Dubuque County Auditor.
Mary Rose Corrigan, City of Dubuque, Health.
We're all looking at you.
I don't think I have my agenda with me.
And I am Allie. I'm the Director of Health for Dubuque County. And to those online,
Good afternoon, Ann McDonough, County Supervisor and Liaison to the Board of Health.
thank you, Ann.
Charlie Potoff, Dubuque County Board of Supervisors.
Wayne Kennecker, Dubuque County Supervisors.
And I see we have someone on an iPhone. Could you please introduce yourself?
There we go.
Looks like that's Diane Freiberger. Thank you, Diane.
Great. All right, so first we'll start off with public comments. At this time, anyone may address the board on matters of which are on the agenda. Please raise your hand on Zoom or your hand if you're here in the room and state your name and address. We will limit the remarks to 3 minutes. Anyone have any comments about something on the agenda at this time? Hearing none, we'll go on to chairperson announcements and updates. And I just have one thing. I wanted to call it to everyone's attention. Probably most of you in the room know about it. It's the Iowa Department of Health and Human Services. They have an opioid update newsletter. The last one was issued in April of 2023. I hope that doesn't tell us their priorities, because maybe it should be every month, but at least we got one from 2023. And one thing that I read in here was so upsetting. And this had to do with the number of young people who have died back in 2021 from opioid, accidental opioid overdose. And they found that in 60% of these young people who died, there were bystanders present that didn't do anything. So they didn't have Narcan. 60%. We could have maybe saved 60% of those teenagers. So really important work that we have to do here in Dubuque County. And I thank you all for attending today. Next, we have the Board of Health Liaison. Ann McDonough, do you have any comments this afternoon?
Well, two things quickly. First of all, I know the auditor's present, and I'm sure he's going to have information that is available about the fact that the United States Supreme Court set the opioid settlement aside. I don't know how that trickles down to affect us. That was with one manufacturer. I hope Kevin has time to give us his expertise on that. I know he's been following the issue. The other thing I wanted just to advise this group about is, and perhaps Mike Fidgen can, I don't know that Mike's going to be able to give us more on this, but the Dubuque Area Substance Abuse Coalition is no longer going to be supported by a specific staff. So the next meeting is August 24th from 1 to 2:30. It's at the ASAC office. It's going to include updates and Narcan training, but it appears as though there's not going to be a provider who's going to be handling any specific agenda items or creating updates. It's just going to be an informational hub. So there's not going to be topics of conversation. So I think it's just another comment to this board that, you know, we have a vacuum in our community of who's doing what. And, you know, the Dubuque Area Substance Abuse Council convened even virtually during the pandemic, but now there's this idea that nobody's going to be calling it together. So anyway, so that's just a point of information. I'm happy maybe others in the room got this update from Alexis Miner from Hillcrest. So thank you, everyone.
Thank you, Supervisor McDonough. Is there a motion to approve? We can't do anything. We don't have an agenda. We don't
This
have.
is a subcommittee meeting, so you would,
We don't have.
you're
to.
not taking action on
Yeah.
anything, you're making recommendations.
Just making recommendations, so we don't have to pass the agenda, but we do have an agenda today. And we also have minutes from the last meeting. I hope everyone got to review them. Were there any additions or corrections to those minutes? Hearing none, then we'll keep those on file.
You'll approve those minutes at the next full Board of Health meeting.
Okay, all right. We'll make a note of that. Next, we have presentations and reports, and Director Ally White, do you have anything to present today?
So I do. Last time we met as a committee, we talked about proposing a coordinator position or a position using opioid settlement funds to employ someone to help oversee the use of those funds. So I do have a starting point of a proposal, and again, it's a starting point, so it would be open for discussion. My goal would be that the subcommittee would review and revise this to take to the Board of Health.
Okay. So none of us, we haven't taken a look at that yet. Do you want to? I mean, I don't think I have it. Do it? Have you?
It's right in front of you.
Yeah.
Oh,
Right there.
I'm just now seeing that.
Okay. Take a second.
Yeah. So, if you want to just kind of tell everyone your thought processes through this while I kind of review it.
Okay, yeah, no, absolutely. So I think we talked about the fact that it's definitely something that I would like passionately like to take on, but given the complexity of overseeing the department, it definitely deserves more time and attention than I can, certainly that I can give to it, or that can be delegated within our department. Surprisingly enough, there are a lot of positions out there posting for similar job duties in different counties. So I did review several of them. They all differed a little bit, but I kind of took what I liked from each of them to put together this proposal. I think the summary and the job responsibilities are fairly standard and written in a way that would allow us for some flexibility as the scope of the work may evolve. Again, I would like some input from the committee as far as, titles, and if it's something we would like to see as a full-time position or part-time. Is it something that we would like to see temporary with the possibility of seeking additional funds to make it a permanent position? Those sorts of things. So again, I'm writing it for the now, but I'm trying to keep the future in mind as well.
Have you, Ally, have you reviewed this with anyone in the county or not yet?
I had sent it to the auditor for review.
Okay.
So I'm wondering if, Kevin, you should update us now about the funds and if anything that will affect our county, I guess.
Can do. So at the last meeting, I had a handout that I gave to everybody. In that interim time that's happened in between then and now, we have received the 2 tranches that we expected for a total amount of $539,530.03. And that's the same number that was on that spreadsheet. So if you have that, it's still valid. In the last week, the Supreme Court ruled on a case with the Sackler family, who were at the time the owners of Purdue Pharma. They are party to one of the settlements that is sort of moving through the system, and that is a $6 billion settlement. One of the ways that settlement was structured was that the Sackler family was offered family immunity from any further future liability. The Department of Justice brought it to the Supreme Court that they do not believe that that deal should include immunity. And the Supreme Court accepted that as a valid argument, so they will be looking at this this case. What that means for us right now is that the $6 billion settlement is on hold. Now, those funds were not calculated into the spreadsheet I handed out prior. Those are other settlements that are out there. But this, I'm never going to say never that this couldn't have some sort of effect on us. There is one firm based out of Virginia that is managing the opioid settlements for states. And so we have a representative named Jamie. I reached out to him last week and I copied the liaison, Supervisor McDonough, on that communication to get their opinion as a firm as to what, if any, ramifications we're looking at. Is this going to delay? Is this going to somehow affect other settlements? And can it change anything for the funds that we already have in place? And so I have not heard back yet. I imagine he's getting that email from a whole lot of different places. So when that information comes through, I will forward it to Allie and she can disseminate to all the interested parties. Aside from that, that's the update I have on funding. Otherwise, it's still there. We are looking at moving it to a separate specific account just for itself so that it can start building some interest, some small investments, some small portions of it. Nothing that would tie our hands or prevent us from using it at any point.
And as far as like leveraging, getting more money from the state, there was some talk about that.
So when the settlement that's structured for the state of Iowa, the way the state of Iowa is doing it is that and I'll use round numbers here, if $100,000 comes into the state of Iowa, the state right off the bat is taking 50% of that and adding it to their response fund. So that's $50,000 to the state. Then there is I don't remember the name of it, but there's a very small fund that's also contributed to out of the remaining 50,000. And then that would leave about $47,000 for the states that are divided up based on the population. So the state is receiving massive amounts of money. And they have not yet, to my knowledge, released a outline or a platform for which people can approach them and say, hey, we're doing this. I think working with local legislators is probably a good idea. I think that reaching out and contacting the people who have the power. And I think showing them programs and showing them what you're planning on doing instead of just saying, hey, we're thinking about doing this. So I think it always works better if we've invested into it and they want to kick it in, then we can just amp it up a little bit.
Mhm. So I think that's what this committee wants to do is to help develop a plan. I know that the health department and the Board of Health wants to be a resource for everybody in the county, the policymakers as well as the citizens going forward. So we want to be helpful and so that's kind of why we've convened this committee.
When I took a look at the job description, I don't have a major horse in this race or the technical expertise to tell you who you're looking for or who you need. But when I do look at it, the questions on the backside of full or part-time, the hourly or salary and the temporary permanent is important, but full or part-time is pretty important because if we're talking a full-time employee, there's a substantial amount of investment above and beyond an annual salary. And if I'm gonna ballpark the idea in my head of where I think this position is going to land salary-wise, if it's full-time, it is effectively going to use up the vast majority, if not all, of our annual allocation moving forward. So I think $100,000 is going to be a nice round number once you factor in benefits and taxes and all of the other things that go along with it. That basically takes our annual contribution and fully spends it for that position. For that year, yes.
Yeah.
That excludes the 500 that we have, the 539,000 that we have currently. And then it also excludes any future settlements that come our way. But we can't really bank on those because we don't have that data. We don't know what's coming, so.
Is it possible for the health department or the county to hire a contract employee, one that does not get benefits, one that is not full-time, part-time, or anything, it's just a contract?
I believe that's possible. I would need to check with our budget director and human resources, but I don't think there's a problem.
I kind of see it in that kind of a position and sort of a program director, and it's a.
The key with independent contractors, so to speak, is that you have to demonstrate that they are performing a duty outside of the scope of our organization. That's going to be a tall order to show, given that this person is basically going to be working underneath the guidance of the Board of Health. You lose that guidance and an independent contractor is going to be hired to do a specific task. And then they are going to decide the best way to do that specific task. So while I like the idea, the suggestion is great, I don't know that in practice for this position, if that's a viable solution. I think you're looking at an employee, whether it's an FT full-time or part-time, whether it's temporary or permanent, I think you're in that realm versus hiring a contractor.
Absolutely. Okay. Mary Rose Corrigan, I'd like to invite you up to the table. You don't have to sit back there. Please come up and join us. Obviously, the county and the city are going to be working closely together on this project, so we want you with us, so.
Yeah, I think you're probably about right on what it would take to salary wise for a position. And I think if we really want to make a difference, I think it needs a dedicated effort, either part-time or full-time. One option we could look at is partnering with another county with a coordinator like Delaware or Jackson, a smaller county that wouldn't quite have capacity to do that. And a lot of the work would flow well in terms of prevention, or if we use money to set up MAT or medication assisted treatment, it's most likely going to be used anyway. So the outreach could be duplicated in some smaller counties. That's a possibility, partnering, and then they could share the cost of the coordinator. One idea. And there's a lot of work to get started. You know, assessing what services we have and then doing a needs analysis. Those are two big things. I mean, we could contract with an organization to do those two components. They're very contractable. And then start from there. I mean, that's another option that would give the coordinator a jump start kind of feature, especially when so competitive hiring people.
Partnering with local counties is a good idea. Keep in mind, so the most recent allocation we received was 77,000 and change. Delaware's allocation was $8,500 and Jackson County's was 15,000. So they are, just based on population wise, they are working with much less. Now, to your point though, when you receive that much less, it's actually harder for them to find a way to spend the funds.
Yes.
So there is incentive there, but if we're looking at, if I don't want anybody to enter under false pretense that we're somehow going to get half of this position paid by other counties, but there could be a portion of it, which would be valuable.
And then it would cover more than one county, which would be much more impactful, I think, because the person would dedicate part of their time to this other county. I can-
Provided the scope was narrow enough that the person
Yeah.
could handle the 3 counties.
Yeah.
you know.
Right. How
Yeah.
much was Clayton County?
Clayton County, how'd you know I had a whole spreadsheet?
Well, it looked to me like you had a spreadsheet.
Clayton County received just shy of 13,000.
And not that we would offer the services we're using out of our funds to those counties, but the outreach and coordination portion.
Well, it's very easy. Many times we implement a program in one county and then we'll farm out our methods and our staff to other counties. This could be a perfect way to sort of recoup some funds for that purpose.
Or also getting some of that pre-work done like we learned in the opioid settlement. While we're looking for a person, I mean, you could maybe look to a local organization to spearhead a needs assessment.
Yeah, and I did, Supervisor McDonough, I see that you have your hand up, so I just want to acknowledge, I see that. I did speak with the Community Foundation and they said that they would be interested. I don't know that they have the capacity right now to take on a large project like that, but that is something too that.
Right, because
considered.
they did the mental health needs assessment and some housing, but there's ECIA, there's other.
And the opioid response network does it, right? They can do a needs assessment and help with that.
I don't think they conduct the needs assessment.
But
They
they
just
can-
simply provide you with the resources that
Okay.
you would need to
Right.
conduct your own. Supervisor McDonough?
Thank you. So just a few comments. First of all, I do think the Community Foundation is going to obviously charge their management fee, and their time frame is I think the immigration one is done a year later. So I don't think that that's a side toward progress. I don't know that you have that kind of time to start mapping. They won't. My experience has been they're not going to deliver a product to you till it's spit and polished, right? It's done. And so you're going to be waiting for that to be completed. We do have a history in Dubuque County of working with Delaware County and sharing employees that you could build off of. We do that in the past. We've done it with our county engineer. We do not currently do it with the county engineer, but we do it with, I think it's 2 other positions in the roads department. One of them is a surveyor. I know that for certain. So the sharing, and it doesn't have to be equal. It can be time allocated. And of course, Delaware County is a partner that we share at the East Central Regional Governing Board. If you are interested in that, or I have a strong relationship with one of the county supervisors there, Shirley Helmricks. It's an easy conversation, Ally, to explore. And I mean, I may do that informationally anyway with her when we travel down to the board meeting still this month. So exploring, I'm glad Mary Rose raised that as something to explore, because I think that's worth pausing and looking to see. Full time at the county for benefits, I understand, is 30 hours. So, you know, it's me, but I'm not afraid to say if the job's worth doing. As I said at the beginning in my comments, the volunteer group that was existing to do this is not. So we're seeing further eroding of systems to do this work. We're going to have to create it. And so the opioid money, I think, is a way to look at your strategic plan, the Board of Health strategic plan, revisiting what you asked for there to see, what does it look like? I don't know, what is that? Maybe Sandra knows 16, 14, 20 months later, what does that look like in terms of staffing? So I would encourage you to make a suggestion and go. If we're wrong, so be it, but starting to move forward, I think time's important here.
The administrator for the Delaware County opioid funds is their county attorney. The administrator for Jackson County is actually their county auditor, Lisa Smith, who I'm close with, so I could reach out to her.
Yeah,
To see,
and
get an idea of what they're doing on their end. And
Right.
if anybody knows, John Bernal. In
John
Delaware
Bernal,
County. Yeah.
sure.
I wonder if
Mhm.
he's most-
But he's the administrator like you are, Kevin. So the
Correct.
supervisors ultimately are still going to be the ones, I'm sure, making those final decisions.
Yes.
But you
and
get a foot in
I
the door, so.
love the idea of partnering. It's something too that I had considered and actually began to reach out to some of our counties that are directly around us. At least one of them is doing, I think they're using their funds differently than what we intend to. I don't know that their health departments will see any of it. I could be mistaken, but I just think it's important to keep in mind that not everyone might be on the same page. Now, I don't mean
No,
to
there
suggest
are,
that's
there
not
are a
working
number of
smart.
counties that are taking the law enforcement approach. There are a number of counties that have left the duty of assigning of funds to the county attorney. And there are other counties that have assigned it to the auditor's
Yes.
office to do. So it is wide ranging what people are using these funds for.
Yeah.
And I think probably, I mean, our goal would be to do some sort of hybrid. I mean, I think law enforcement certainly probably needs some, but it's definitely a public health issue.
The other
Big one.
thing that could be added to the job description to work with you, Ally, is to seek alternative funding sources.
I think it's on there.
Oh, is it?
Yeah.
Okay.
So initially, and I think, I had gotten some feedback, Amy had offered to take a look at it prior to today's meeting, just so that I had a few eyes on it. And one of the things that we had talked about was the position title. And I initially did have it as an opioid settlement funds coordinator. But like I mentioned, I think it's important, and I think I hear Supervisor McDonough kind of saying the same thing. It's important for us to think past the now. So however many years from now, these funds aren't going to be here. But the position, we might find that it's valuable and still needs to be here. So that's kind of where I landed on the other position title, opioid substance use disorder program coordinator.
And we can call it that. The funds don't restrict.
No, the reporting requirements for the use of these funds are that if we don't use these funds for any of the recommended items in Schedule E that Ally's handed out previously, then we have to report what we use those funds on. But at the end of the day, these funds are to be looked at as tax dollars, revenue for the county, and we can spend as such.
Okay.
So this squarely falls in the ability to use this with no reporting function needed.
On that thought, Ally, what about getting rid of the opioid substance abuse altogether and just calling it a special programs coordinator or something like that? Does it have to be real specific?
Or outreach.
Or
Yeah,
special?
I am not by any means.
What, outreach coordinator or, yeah.
Well, they're tracking, they're doing more than outreach, so they're. training.
I just was hesitant to use settlement funds in the title in the event that it were to be something that additional funding were to be sought to sustain it past.
True.
You don't want it that narrow.
That was just my only.
The only feedback I did offer was when I look at creating job descriptions and putting it out, there obviously is a measure of technicality and experience that you need, but in my experience is keeping things more broad to allow you the latitude has served me well. That doesn't mean it's going to serve everybody else well, but.
Yeah, I certainly like that idea, Tim.
And the idea that we worry about if it's going to be permanent, full-time or not, this is county government. Technically, no job is permanent, full-time if the board decides they don't want to fund it. So coming out of the gate and calling this a permanent full-time position that you're going to fund with opioid funds will get you a lot more candidates than saying that this is a
Right.
full-time temporary position.
Oh.
And then when the funds run out, if the funds run out, then the conversation can be had with the board whether or not the
Great.
position should continue.
Great.
But that's opening up a little more,
Yeah.
you know, hopefully widening the applicant pool.
So we could call it something like public health special programs coordinator or public health outreach coordinator.
Programs and outreach. We'll have to.
Yeah.
we'll have to
We'll figure
link
that out.
Yeah,
figure that out.
absolutely.
But Amy, do you think that most of the responsibilities and everything, qualifications, everything, do you agree with?
My suggestion for qualifications, was to expand it to behavioral health rather than public health and public administration, because you would find a bigger pool and a more targeted pool, to work with this program.
So you're suggesting adding that?
Yes,
Or if substituting,
yes,
adding. I think that's a good idea.
That it could also be social work.
Yep, that's what I said, social work, counseling, psychology. I don't know if I wrote all that, but in my notes, I wrote those three. And then I also said K-CRAP, or not K-CRAP, CADC, having that certification.
What is that?
What is it, Ally? I wrote it up for you.
Oh, is that,
Drug and
Certified alcohol and drug.
it's a substance abuse,
Counselor.
yeah, 'cause that's one of the deputy sheriffs, I think, is currently taking that training or has taken that training. And, so they'll have somebody with that certification, in the jail, yeah.
Fantastic. Certified drug and alcohol counselor,
Okay. Add that.
Does,
preferred, I would say.
Or like
preferred.
within 6 months of hire, I don't know what the course entails, but maybe, I don't know how many applicants we'd get that would have it currently, but
Yep.
have the
Yep.
capacity
Yep.
to.
I think the course is fairly in-depth. Last time I talked to the sheriff, it was a
Yes, it
fairly
is.
in-depth
Yep.
course.
Mhm.
At the last meeting, we talked about data and how everybody has the data, but nobody knows where all the data is, and we don't have one solid point of where. You know, like, nobody in this room or on the Zoom call can tell us how many doses of Narcan are in Dubuque County. I see that it says provide quality information and guidance, but from my own outside opinion, fresh eyes, part of this position has to be data-driven and have to have the ability to figure out where the best place to get all that data is and how to meaningfully organize it. And then give it to me so we can visualize it in GIS and play around with it and get it out to the public. But I think that has to be one of the top priorities, because having somebody who can do all of these things on paper, but then isn't so great with the data is, I think the whole reason
I
we're here is because we don't know the answers.
I
you know?
agree.
Right.
What
That
do we,
is where
what
I
do we,
can,
I'm sorry,
no, you go ahead.
what do we want them to do with the data? Collect?
So when I called, I heard an advertisement on the radio. And the radio said that if you go to any pharmacy, you can get Narcan. And so I called up Supervisor Potoff and he's like, I haven't heard of that. And then he called somebody and the first answers we got were like, what are you talking about? And then Ally was working around it. And so nobody knew what the answer was. And finally we got the answer.
Yeah.
And when I asked how many doses does the county own and how many doses do other entities own, nobody really knows. And where are those doses at? And then where are the needs? I mean, we can not pinpoint, but we can reasonably determine geographic areas and regions that are in a need for this and a need for the services, not just Narcan, but a need for services, rehabilitative services, services that prevent recidivism, you know, all of those things. But nobody really has that answer. And yet everybody has a little bit of the data. So when I say that, what I'm meaning is one person who really is going to talk to every single person, grab whatever data they have and start to accumulate it into one meaningful volume.
That's gonna take a really close relationship with the Iowa Department of Health and Human Services. At least one that can still available.
So there is one of those, relationship with IDPH, a bonus, you know, under qualifications or something along those lines, or knowing how to navigate the Iowa public health system, you know.
Right, because they own the doses right now that are in the pharmacies by virtue of they are the ones that pay for it. The
Right.
pharmacies should be keeping it and then they get reimbursed for it.
But they're the only ones that know how much pharmacies have. We don't have any idea.
No, and a lot of them just aren't keeping it.
I think Supervisor McDonough has her hand raised.
Yes, thank you. I just want to be sure that I don't believe this is a therapist. This isn't someone who's going to put hands on people, who's going to make private appointments. This is a systems person. And I like the comment about the relationship with Iowa Department of Public Health. This is the coordinator. This is the overseer, the person who understands the system and is helping us create that, not someone who's been doing the actual therapy. I strongly believe that if you are looking for someone who is required that they're a therapist, you're not going to be looking at the same class of people, the same type of background. When we searched for the CEO for the East Central region, we were even looking at people who had their MBAs. We were looking for someone who was looking at a system, not at someone who had been in a therapeutic relationship. So I just want to be clear about that. I haven't seen the job description, and that's fine. I don't need to, but it is, you don't need a bunch of credentials behind your name, other than maybe someone who's done some analysis and some systems creation. And reporting back is going to be critical in grant writing, and that isn't necessarily a social worker.
I will agree. I don't know that a social worker would necessarily be, someone with a social work degree would necessarily be excluded. But I do really agree that looking at it from more of a business lens than anything else is probably what's going to make a candidate most successful.
And does or related field, does it kind of, like if we put public health, public administration, behavioral health or related field, I mean, that's probably adequate right there. Yeah.
Right. The other thing I was thinking with this, is that this position could be the person who runs DASAC. So,
True. Yeah.
I mean, there's all sorts of possibilities that can happen with this position.
Okay,
Can I make one comment about the pay?
yes,
Just
absolutely.
if you can keep it down as much as possible, just, I know, I appreciate all of you know how hard it is to find people to do jobs now, but there's so many direct services that are needed, and there are just so many people, so many families that have been impacted by this, that it kind of made me sick to my stomach when I heard your first, number that would use up so much of the funding.
Well, it's not just, I mean, it's the computer. it's the
Yeah.
gas.
When you start to add in the cost of
I
adding an
know,
employee,
I know.
if you hire somebody at 60 grand a year or 50 grand a year,
Still 100 by the time.
you're at 100 by the time you look at the total investment of what you're looking at, what you
Yeah.
have. And,
So-
and are you getting quality at 50 or 60 grand a year? Are you getting what you want?
Right, so I love your ideas, Mary Rose, about partnering with people on that, because anything you can do to keep it down.
But
I
making,
understand, I appreciate how hard it is to find people.
What
Right,
do you mean? I'm sorry, I have to
Just
keep it down.
the wage, like when Kevin first stated the wage and how that was gonna use up so much of the recurring money coming in, I thought, oh my gosh, you're paying so much for a person then to manage funds and programs that we might not have a lot of funding for, but I understand, I
Sure.
appreciate it.
Well, I
I
just want to make sure.
I just know the reaction from like families that have been, because that's what I've dealt with mostly, and worked with families and advocated with families, and like if this number, is out there, they're gonna be like, oh my gosh, they're spending so much money, and people that aren't in the hiring position don't understand all those costs.
Right.
So just to be mindful that, and I know you're all very good stewards of the money, but
Well, I think
just,
part of this is this is also going to increase awareness that more funds need to be
yeah, that this
been
isn't a
generated.
big pot of gold.
This isn't a big pot of
everybody
gold. This
thinks,
isn't
yeah.
the silver bullet.
Right.
This is helping us get an edge on a problem we know exists.
Yeah,
And letting the public know that this does need to have investment, not just public, but also private
right.
investment. And so I think that part of this coordinator position is also going to be not just telling the supervisor in the county and the city and other governmental entities, how do you fix the problem? But telling your local businesses how you fix the
The whole
problem.
community, yeah.
Telling the community, we have that, if you see something, say something that popped up after 9/11. We need a campaign like that, something like that, that is going to make people cognizant. This isn't just in another city. It's not just in Illinois. It's right across the street in some cases.
Mhm.
I have an employee where an OD death occurred right across the street. And this happens everywhere.
I
So
was-
the other
I-
thing, please be mindful of is that this was part of this Board of Health's, your conversation about reimagining the health department pre-exists the settlement dollars. If you make the job description be a person, some of these things were already in your wish list and your needs assessment of what we needed in the department for it to grow. So you don't have to use every dollar from settlement money. There can be a match of a salary at the county level that comes from settlement dollars, or however it can be constructed. That's when you go to the budget director and to the Board of Supervisors to open up the discussion as well. So you don't have to Diane's point, you don't have to use every last dollar for this. You can make the job description and be the employee, find the individual who's going to move the department forward as well, and ask the county to support that through our general budget.
So another thing that popped into my head, will we have any needs assessment data from the CHA-CHIP that could help with this?
Cha-Chip, I think the Cha-Chip is still sort of in the beginning stages, so we probably won't have any data from that that's relevant for a while, will we, Ally?
Not till November.
But I mean, it would be sooner than the foundation.
Yes.
Yeah,
But
Yeah.
is there stuff from there that we could use? Or
it's not gonna
specific?
be specific enough.
Okay.
If I'm being honest, it might say, I mean, there is one of the three main focus areas is on brain health, mental health, and substance use. I don't know if it's going to be as specific as what we talked about, going around and seeing which pharmacy has Narcan and how much, and do they have a process for distributing it? I think that, again, is another example of when I said at the beginning of the meeting, it's going to take the undivided time and attention more than what.
And Mary Rose, I appreciate your thought about maybe contracting the mapping and the needs assessment out, and that might be something that we have to do, but I really think we need our coordinator first. We have no one to keep an eye on someone, a consultant. We really don't anymore, because we're already doing strategic planning, the CHA-CHIP, still doing the last parts of the after action report and all that. There's just so much right now.
On top
So
of the daily.
on top of the daily. So I really think for our department, we need that coordinator person first.
I envision the coordinator leading an assessment.
Yeah.
I don't think it has to be, this is just me thinking out loud. I don't think it has to be something super formal,
Yeah,
but it's going, I mean, it could be as simple as getting in your car and driving around from pharmacy to pharmacy if that's what we need. But that's something that I envisioned this position taking the lead on.
and hopefully we can get someone with some type of background, systems background, business background that will know what they need to complete this, so that maybe we need at that point, maybe that person will say, Board of Health, we need a consultant to do part of this, so that's kind of how I see it. So I feel that the first step is, let's get this employee, so. Any other comments on the description, Amy?
Remember,
I
did I
have
have
your
any other?
email.
Yeah, do you have
You
any
want me
other?
to pull
Yeah.
it? Give me 1 second.
While you're looking at
Clearly,
that,
this is the most prepared I've ever been in my life. Go ahead, Al.
I was just gonna say, that'll give you some time to look and maybe check in with some of the other supervisors that are joining us on Zoom. I don't feel like I'm putting you on the spot, but if you have comments to share, we would certainly welcome them.
The other person you should check with is May Hinchin, because the county cannot spend any money on brain health. Those dollars are restricted by the state of Iowa. So we need to be, again, I haven't seen the job description, but please check to make sure that we're in the proper lane. Obviously, brain health is a critical priority for the whole county, all of our systems, but the job description should not include that as something they're going to be working on toward spending funding, because we're prohibited from doing that.
You're saying it should be geared specifically towards substance misuse and not brain health.
So the brain health work is being done. It's done by the region. I'm suggesting that you just send that over to May Hinchin to make sure that we're in the right lane. Okay.
And I did send the draft job description to all three supervisors. It should be in your inbox.
So, yeah, one other thing that I did talk about was, knowledge about co-occurring disorders so that mental health disability services could be a partner. So that was one thing that I did, talk about here. And I also, and this would have to be with the coordinator though, somebody to talk to ASAC and Turning Point and, the area treatment agencies to, make sure that everybody's on the same page and, working together, not, collaborating, not
And I think
competing.
those types of activities are covered in this job description, it seems like, yeah. Mike, did you have a chance to look at the job description? Do you have any comments?
Sandra, I have not had a chance to look at it yet, so I'll
That's fine,
hold my comments.
thank you. And Harley or Wayne, do you have any comments for this committee today? Hi, Wayne.
I do not, thanks.
All right, thank you. And Harley?
I do not, thank you.
Thank you, Harley. I'm so glad that you both, all three of you are here. We really appreciate that. Okay, so do you think that committee, do you think we can present this to the Board of Health then tomorrow, this job description?
Yes, except that the position name is like TBA probably,
Okay.
unless we think of something really quickly.
And
You want me to just keep it as open?
do we,
Yeah.
do we need to have HR look at it before we act on it? Or have we done that? Have we done our due diligence?
I would say that for this purpose, the Board of Health would be approving a job description. And that the human resources elements such as benefits, salary, what that range looks like, what total cost of the county is a separate conversation. That's very administrative in nature. So
Okay.
the Board of Health come up with the job description. And then we can rely on Ally or somebody else to do a sort of a comparable to see what those positions are paid. And then we can get that through the HR process, which will be a lot easier once we have the finalized job description.
And those steps would all be completed before we take it to the Board of Supervisors.
Absolutely, yeah. A budget impact would have to be run, so we know what it's gonna cost. Even if it's coming out of the opioid funds, that's a good number to know so that we know what we're working with and what we're gonna have left. And it'll help us allocate those funds, because prior to us using any of the opioid funds, we actually have to allocate it within our budget.
Okay,
And currently, it's not allocated, so that would happen along the lines of a budget amendment process. So given the time frame of what it would take to acquire this employee and get all the details worked out, we'd be looking at our next amendment, which is probably in the November, December time range, is when we would be amending those funds into the county budget to be able to be utilized.
okay.
So this isn't sort of the thing where we can just hire someone and then get them a check right off the bat. We've got to make sure we have all the
Right.
administrative pieces in line.
Would that mean that we couldn't hire until then, or?
Nope, you could hire, you could interview, because obviously if you're finding somebody who's out of the area, they're gonna need, with
Yeah.
notice and with the interview process and given the nature of the Board of Health, this person will likely have to meet with more than one person. That's a process that's gonna take 30, 60, 90 days.
Yeah.
So yes, you can certainly make decisions, but as far as putting that person on payroll until funds are properly in place, we
Okay,
would not be able to compensate that individual.
all right.
Okay, so I don't know if we need to decide this, but I think we kind of decided it would be a full-time position.
I think it needs to be. I personally do, but especially if we might end up partnering with other counties or.
So you're here to make a recommendation to the
Yeah.
full Board of Health.
Yeah.
So if your recommendation is that it's full-time,
Mhm.
then that's the recommendation you'll make to the Board of Health. And then Mike will offer his input, as will the other members of the Board of Health. And this may morph or change,
Yeah.
Right.
You're giving a
This is a
baseline.
recommendation, yeah. So is the committee comfortable with making this recommendation to the Board of Health? I think so. Seems like it. Yeah.
Yes,
We don't have- Yep, Mike, you're okay with it? Okay.
I'll be
go
ready
ahead.
by the time we get to the meeting tomorrow. I need to look it over though.
Okay, great.
Yep.
All right. So, Ally, thank you so much for all the work that you put into that, and also to the auditor and to Amy Crow Sunley for working in the background to get this all set up in a rather rapid way. So I appreciate that. We'll discuss this then tomorrow at our Board of Health meeting. I don't think there are any action items today. Any unfinished, let's see, here. Any action items?
No, I think, I believe that you have successfully fulfilled the goal of today's meeting.
Thank you. We can respond to public questions. I haven't gotten any public questions. Does anyone else? And unfinished business, we have none. New business, we have none. And any other communication or reports? No. In that, when would you like to have the next meeting? I would like to have it, do we need to meet again before this would go before the Board of Supervisors? I don't think we do.
The subcommittee probably has completed its task.
Okay.
So I think the meetings from here on out would involve the full Board of Health, finalizing the job description, finalizing what their recommendation is for compensation, working with the county to get all those schedules in place, and then getting it in front of the Board of Supervisors for approval to be funded through opioid settlement funds.
Yeah.
Whether or not that's 2 Board of Health meetings or 1, sort of depends on the next Board of Health meeting. I'm gonna go on a limb and say it's probably going to be 2 full Board of Health meetings before you get to the point where you're gonna bring it to the supervisors, because your next meeting is tomorrow.
Yeah,
At what time?
4:30.
So you have an hour and 40 minutes to publish that agenda. So you're not gonna have a whole lot of time to sort of finesse what you might need to finesse prior to tomorrow's meeting.
Yeah, well, we did list it, but we didn't have the specifics, so
Gotcha.
you'll have to take a look at it. But
Can I ask a question? I don't really know what my role is and when I can speak or not, but.
you can speak
Yeah.
anytime you
Okay.
would wish to, as
Okay, do any of you remember House File 595 that I brought up in a few meetings, how the board or the local health department can be a secondary distributor of Narcan?
yes.
Okay, so that went into effect July 1st. It also, I've been concentrating kind of on the school district, the local, or the county health department, but also I realized that there is the opportunity for licensed healthcare professionals to do this. So I did just find out from Kevin Gabbard, they're almost done with the protocols. I didn't know if you all have been looking at that at
I
all.
haven't seen it. I mean, I
Okay.
haven't been able to keep up with it. So
Okay.
anytime you can report to us, I think that's
Okay.
wonderful.
And Mike Fidgeon, do you know if Hillcrest is looking into that at all? Maybe.
I am not certain at this time. I'd need to talk to a couple people about that.
Okay, there's one local health provider, a licensed behavioral health provider that is working on it. They don't want me to say it yet, who they are, but should they just communicate with you then, Ally? Or do you'd want to know, I'm guessing,
If they're interested in becoming a secondary
provider, yeah.
distributor.
Yeah, I know a lot of people are wanting to wait until Narcan comes out over the counter, but I think if there are opportunities, and especially if there's funding from the state, we should do it now, because I still don't know when that's gonna come out over the
This
counter.
doesn't need like sanctioning of the Board of Health. does
Yeah.
it?
No, the local county health department can do it. They're one of the entities that can do it. A licensed behavioral health provider can. I just think they should make the county health department aware if they're doing it, and
I don't think that
Sure, it'll
the
be on
health
the website.
department or the Board of Health would have
You don't need
any
to know.
jurisdiction or oversight or anything. I mean,
They
okay.
could
it'd be a
report just
professional
for-
courtesy.
Yeah, and you
record-
can
Just for
promote it
record
even.
keeping, so we would know.
Yeah, when we're talking about all that data and
Yeah.
stuff,
Yeah.
I thought, okay.
Diane, I'm not really aware of this program. What would this program do? What could the health department do if we chose to do it?
So this is new. This was signed into law like in May, and it took effect July 1st, but there was no protocol for our Department of Health and Human Services and the Board of Pharmacy in conjunction to figure out how to do this. So you could be a secondary distributor, meaning you could get Narcan from a pharmacy source,
Is that the one, the
the nasal.
nasal?
Mhm.
Okay.
And then you could distribute it to the community. This is like unprecedented.
To whom? Like to anyone who wants
Anyone
it?
that is deemed to be a person in a position to assist. So this is, I brought it up, nobody thought it was gonna go through.
So like, just for example, if a family member came here to the health department and said, I want to have some Narcan because I know my uncle is using or something like that, then Ally could give that person no ID necessary or?
Well, that's what we're waiting on the protocol for.
All right,
And so that,
all right.
because it's still a prescription, you know, we had to come up with a program in the state of Iowa that would not
Yeah.
break laws and rules and, I assume they're gonna have some sort of training. That's the first thing I saw was they would probably require some sort of training and some record keeping. But it would be much easier. My vision would be you could go to a community event, set up a table, do training and, you know, it'd be, people could access it much easier than they are now, hopefully.
Hopefully that guidance comes from the state, because there are cases where laws are written and then there is actually no administrative guidance.
Yeah.
Right, and that's
So-
why I think it's taken so long. No, this is from Kevin Geber. What is he, the opioid? He's like the top person.
Yeah.
at our- He's above Monica Lowski Brown. Yes.
Okay, so do you think, we'll meet in 2 months then? Should we meet in 2 months or how do you feel?
I think to be determined, yeah,
Okay,
TBD,
okay,
yeah.
So
Because we'll
can,
have to see what the full board thinks.
yeah.
Sandra,
Because
can I just please, so citizens are
what?
the citizens are waiting for us to act. And I think even if we meet next month and we all say, we're getting just an update from Diane and from any other group that wishes to present, we must continue to meet. We must. We have not accomplished work today that is substantive toward making people's lives different. We are working inside the system to hire someone at some future date with some sense of urgency, maybe, right? So if we don't meet, I guess I want to hold y'all accountable. I'm on this committee. I think we need to meet monthly. And I understand there's not a lot that our health department can do, but we are the forum for citizens. And so if we don't continue to do this, where do they go? We have to
Well-
we have to meet every month. We
Okay,
must.
I thank you for that input. I tend to agree that we do have other things to work on, as far as trying to get the Narcan out there, and so maybe we should, continue to meet. on a
And you
regular
could
basis.
invite the schools. You could make next month be about the school connection. What are they doing? Because they're struggling with issues about administrative ability to do things too. I mean, Ally and Diane probably know that as well. So
That's all
maybe
good.
that would be a way to come forward with that.
I do want everyone to be aware that they were directly invited, the school districts were directly invited to our previous meeting for that very reason.
Okay,
But I don't disagree that it is important to keep an open seat at the table for
yeah,
them.
and maybe, you know, sometime if we have a meeting next month, maybe we could have a special invitation, have somebody present or something. We'll talk about that, but let's,
I think last time we met, we talked about maybe not meeting back to back, like opioid one day, Board of Health the next, simply because of the administrative
yeah.
side of things. So just,
How much time, do you think we should, a week apart or 2 weeks apart or?
Tuesday, September 19th. Nope, that would be back to back, Tuesday, September 12th.
Yeah, because like today, by the time this meeting, so and with our bylaws, it really is too late to put it in, because we
Yeah,
have 48
no,
hours in our bylaws.
exactly.
So yeah, that would make more sense to have it 3 to 4 to 5 days before a board meeting.
And maybe even at the rate that I'm getting.
So that would be like a week before. by
Maybe
the
a
time
week.
it
Yeah.
In the
Yeah.
interest of, I know there are a few people in this room who have pretty hard stops in just 2 minutes. What if we circulate an email amongst the stakeholders here to determine the next date for that meeting?
Okay, that's great. Okay, I think we've finished our business for the day, and I'll adjourn the meeting. And we will get back with everyone about the next date. Thank you for coming.
Thank you all.
Yes.
Thank you.
So, in this little newsletter, you guys, there was a Sam